as a clinician, you're at the internal locus of control. It doesn't mean you don't recognize the constraints and challenges that patients face, but I would say to try to harness um, that internal locus of control. What can they do? And one of the most important things, I see this everywhere, is that people have to work. That work is the best therapy there is for folks. And you know, the longer you don't work, the longer your skills atrophy and your confidence erodes, and the more reluctant you are to get back into the system. And so that is actually one of the big sort of agenda items. To me, that is just one of the most important things. And often what gets in my way is that I would invoke disability policy, stipulate everyone's well meaning. But I see both. I see people who really do need that kind of assistance and they can't get it no matter what they do. And that's frustrating. But I also see people who are on disability and it just took them out of the workforce. It frankly, it reified the fact, or convinced them that whatever mental health diagnosis they were given is what's keeping them from being unproductive. I don't even care if it's a job. I want people to be productive and engaged and be a role model for their kids and have a purpose and have a social network that's at work and not also just in their neighborhood because that's all their drug using friends are there. And so that's something that I would kind of focus on.